Medical Surgical Nursing Exam 11. Question 1. According to Maslow, which of the following categories of needs represents the most basic? A. Physiologic needs. Physiologic needs must be met before an individual is able to move towards psychological health and well-being. B. Self-actualization. Self-actualization is the highest level of need. C. Safety and security needs. Safety and security needs, while lower level, are not essential to physiologic survival. D. Belongingness. Belongingness and affection needs are not essential to physiologic survival. Answer: A. Question 2. Which of the following statements reflects the World Health Organization's definition of health? A. A state of complete physical, mental, and social well-being and not merely the absence of disease and infirmity. Such a definition, however, does not allow for any variations in degrees of wellness or illness. B. A condition of homeostasis and adaptation. The WHO definition addresses physical, mental, and social dimensions of being. C. An individual's location along a wellness-illness continuum. The concept of a health-illness continuum allows for a greater range in describing a person's health than the definition provided by the WHO. D. A fluid, ever-changing balance reflected through physical, mental, and social behavior. The WHO definition does not allow for any variations in the degrees of wellness and illness. Answer: A. Question 3. Which of the following statements defines culture? A. The learned patterns of behavior, beliefs, and values that can be attributed to a particular group of people. Included among characteristics that distinguish cultural groups are manner of dress, values, artifacts, and health beliefs and practices. B. A group of people distinguished by genetically transmitted material. A group of people distinguished by genetically transmitted material describes the term race. C. The status of belonging to a particular region by origin, birth, or naturalization. The status of belonging to a particular region by origin, birth, or naturalization describes the term nationality. D. The classification of a group based upon certain distinctive characteristics. The classification of a group based upon certain distinctive characteristics describes the term ethnicity. Answer: A. Question 4. The reason that case management has gained such prominence in healthcare can be traced to: A. Decreased cost of care associated with inpatient stay. The reasons case management has gained such prominence can be traced to the decreased cost of care associated with decreased length of hospital stay, coupled with rapid and frequent inter-unit transfers from specialty to standard care units. B. Increased length of hospital stay. In general, length of hospital stay has decreased over the past 5 years. C. Discharge from specialty care units to home. In general, patients are transferred from specialty care units to standard care units at least 24 hours prior to discharge. D. Limited availability for inter-unit hospital transfers. In general, patients in acute care hospitals undergo frequent inter-unit transfers from specialty to standard care units. Answer: A. Question 5. A preferred provider organization is described as A. Business arrangement between hospitals and physicians. PPOs usually contract to provide healthcare to subscribers, Usually businesses, for a negotiated fee that often is discounted. B. Prepaid group health practice system. A prepaid group health practice system is termed a health maintenance organization. C. Limited insurance program. Insurance is a cost payment system of shared risk, not a healthcare delivery system. D. Healthcare savings account program. A healthcare savings account program is an incentive program to consumers, not a healthcare delivery system. Answer A. Question 6. Which of the following categories identifies the focus of community, public health nursing practice? A. Promoting and maintaining the health of populations and preventing and minimizing the progress of disease. Although nursing interventions used by public health nurses might involve individuals, families, or small groups, the central focus remains promoting health and preventing disease in the entire community. B. Rehabilitation and restorative services. Rehabilitation and restorative services are the focus of extended care facilities and home care nursing. C. Adaptation of hospital care to the home environment. Adaptation of hospital care to the home environment is the focus of home nursing. D. Hospice care delivery. Hospice care delivery refers to the delivery of services to the terminally ill. Answer A. Question 7. A major goal for home care nurses is A. Restoring maximum health function. Tertiary preventive nursing care, focusing on rehabilitation and restoring maximum health function, is a goal for home care nurses. B. Promoting the health of populations. Promoting the health of populations is a focus of community, public health nursing. C. Minimizing the progress of disease. Minimizing the progress of disease is a focus of community, public health nursing. D. Maintaining the health of populations. Maintaining the health of populations is a focus of community, public health nursing. Answer A. Question 8. In the United States, nurses performing invasive procedures need to be up to date with their immunizations, particularly A. Hepatitis B. Hepatitis B is transmitted through contact with infected blood or plasma. B. Hepatitis C. Hepatitis C is found mainly in underdeveloped countries with substandard sanitation and water quality. C. Hepatitis A. Hepatitis A is transmitted through the oral route from the feces and saliva of an infected person. D. Hepatitis C. At present, immunization against hepatitis C is not available. Answer A. Question 9. At what time during a patient's hospital stay does discharge planning begin? A. Admission. To prepare for early discharge and a possible need for follow-up in the home, discharge planning begins with the patient's admission. B. 24 hours prior to discharge. Discharge planning requires identification of patient needs and anticipatory guidance and is not relegated to a specific time for beginning. C. The shift prior to discharge. Discharge planning requires communication with and cooperation of the patient, family, and healthcare team and is not relegated to a specific time for beginning. D. By the third hospital day. Discharge planning may require involvement of personnel and agencies in the planning process and is not relegated to a specific day of hospital stay. Answer: A. Question 10. The leading health problems of elementary school children include: A. Cancer. The leading health problems of elementary school children are injuries, infections, malnutrition, dental disease, and cancer. B. Alcohol and drug abuse. Alcohol and drug abuse are leading health problems for high school students. C. Mental and emotional problems. Mental and emotional problems are leading health problems for high school students. D. Homicide. Homicide is a leading health problem for high school children. Answer: A. Question 11. Which skill needed by the nurse to think critically involves identification of patient problems indicated by data? A. Analysis. Analysis is used to identify patient problems indicated by data. B. Interpretation. Interpretation is used to determine the significance of data that is gathered. C. Inferencing. Inferences are used by the nurse to draw conclusions. D. Explanation. Explanation is the justification of actions or interventions used to address patient problems and to help a patient move toward desired outcomes. Answer: A. Question 12. The ethics theory that focuses on ends or consequences of actions is the: A. Utilitarian theory. Utilitarian theory is based on the concept of the greatest good for the greatest number. B. Formalist theory. Formalist theory argues that moral standards exist independently of the ends or consequences. C. Deontological theory. Deontological theory argues that moral standards exist independently of the ends or consequences. D. Adaptation theory. Adaptation theory is not an ethics theory. Answer: A. Question 13. Which of the following ethical principles refers to the duty to do good? A. Beneficence. Beneficence is the duty to do good and the active promotion of benevolent acts. B. Fidelity. Fidelity refers to the duty to be faithful to one's commitments. C. Veracity. Veracity is the obligation to tell the truth. D. Non-maleficence. Non-maleficence is the duty not to inflict, as well as to prevent and remove, harm. It is more binding than beneficence. Answer: A. Question 14. During which step of the nursing process does the nurse analyze data related to the patient's health status? A. Assessment. Analysis of data is included as part of the assessment. B. Implementation. Implementation is the actualization of the plan of care through nursing interventions. C. Diagnosis. Diagnosis is the identification of patient problems. D. Evaluation. Evaluation is the determination of the patient's responses to the nursing interventions and the extent to which the outcomes have been achieved. Answer: A. Question 15. The basic difference between nursing diagnoses and collaborative problems is that: A. Nurses manage collaborative problems using physician-prescribed interventions. Collaborative problems are physiologic complications that nurses monitor to detect onset or changes and manage through the use of physician-prescribed and nursing-prescribed interventions to minimize the complications of events. B. Collaborative problems can be managed by independent nursing interventions. Collaborative problems require both nursing and physician-prescribed interventions. C. Nursing diagnoses incorporate physician-prescribed interventions. Nursing diagnoses can be managed by independent nursing interventions. D. Nursing diagnoses incorporate physiologic complications that nurses monitor to detect change in status. Nursing diagnoses refer to actual or potential health problems that can be managed by independent nursing interventions. Answer: A. Question 16. Health education of the patient by the nurse. A. Is an independent function of nursing practice. Health education is an independent function of nursing practice and is included in all state nurse practice acts. B. Requires a physician's order. Teaching, as a function of nursing, is included in all state nurse practice acts. C. Must be approved by the physician. Health education is a primary responsibility of the nursing profession. D. Must focus on wellness issues. Health education by the nurse focuses on promoting, maintaining, and restoring health, preventing illness, and assisting people to adapt to the residual effects of illness. Answer: A. Question 17. Non-adherence to therapeutic regimens is a significant problem for which of the following age groups? A. Adults 65 and over. Elderly people frequently have one or more chronic illnesses that are managed with numerous medications and complicated by periodic acute episodes, making adherence difficult. B. Teenagers. Problems of teenagers, generally, are time-limited and specific, and require promoting adherence to treatment to return to health. C. Children. In general, the compliance of children depends on the compliance of their parents. D. Middle-aged adults. Middle-aged adults, in general, have fewer health problems, thus promoting adherence. Answer: A. Question 18. Experiential readiness to learn refers to the patient's A. Past history with education and life experience. Experiential readiness refers to past experiences that influence a person's ability to learn. B. Emotional status. Emotional readiness refers to the patient's acceptance of an existing illness or the threat of an illness and its influence on the ability to learn. C. Acceptance of an existing illness. Emotional readiness refers to the patient's acceptance of an existing illness or the threat of an illness and its influence on the ability to learn. D. Ability to focus attention. Physical readiness refers to the patient's ability to cope with physical problems and focus attention upon learning. Answer: A. Question 19. Asking the patient questions to determine if the person understands the health teaching provided would be included during which step of the nursing process? A. Evaluation. Evaluation includes observing the person, asking questions, and comparing the patient's behavioral responses with the expected outcomes. B. Assessment. Assessment includes determining the patient's readiness regarding learning. C. Planning and goals. Planning includes identification of teaching strategies and writing the teaching plan. D. Implementation. Implementation is the step during which the teaching plan is put into action. Answer: A. Question 20. Which of the following items is considered the single most important factor in assisting the health professional in arriving at a diagnosis or determining the person's needs? A. History of present illness. The history of the present illness is the single most important factor in assisting the health professional in arriving at a diagnosis or determining the person's needs. B. Physical examination. The physical examination is helpful but often only validates the information obtained from the history. C. Diagnostic test results. Diagnostic test results can be helpful, but they often only verify rather than establish the diagnosis. D. Biographical data. Biographical information puts the health history in context but does not focus the diagnosis. Answer: A. Question 21. Of the following areas for assessing the patient profile, which should be addressed after the others? A. Body image. The patient is often less anxious when the interview progresses from information that is less personal to information that is more personal. B. Education. Educational level is relatively impersonal and readily revealed by the patient. C. Occupation. Occupation is relatively impersonal and readily revealed by the patient. D. Environment. Housing, religion, and language are relatively impersonal and readily revealed by the patient. Answer: A. Question 22. Which of the following methods of physical examination refers to the translation of physical force into sound? A. Percussion. Percussion translates the application of physical force into sound. B. Palpation. Palpation refers to examination by non-forceful touching. C. Auscultation. Auscultation refers to the skill of listening to sounds produced within the body created by movement of air or fluid. D. Manipulation. Manipulation refers to the use of the hands to determine motion of a body part. Answer: A. Question 23. In which range of body mass index (BMI) are patients considered to have increased risk for problems associated with poor nutritional status? A. Below 24. Additionally, higher mortality rates in hospitalized patients and community-dwelling elderly are associated with individuals who have low BMI. B. 25-29. Those who have a BMI of 25 to 29 are considered overweight. C. 30 to 39. Those who have BMI of 30-39 are considered obese. D. Over 40. Those who have BMI over 40 are considered extremely obese. Answer: A. Question 24. To calculate the ideal body weight for a woman, the nurse allows: A. 100 pounds for 5 feet of height. To calculate the ideal body weight of a woman, the nurse allows 100 pounds for 5 feet of height and adds 5 pounds for each additional inch over 5 feet. B. 106 pounds for 5 feet of height. The nurse allows 106 pounds for 5 feet of height in calculating the ideal body weight for a man. C. 6 pounds for each additional inch over 5 feet. The nurse adds 6 pounds for each additional inch over 5 feet in calculating the ideal body weight for a man. D. 80 pounds for 5 feet of height. 80 pounds for 5 feet of height is too little. Answer: A. Question 25. A steady state within the body is termed A. Homeostasis. When a change occurs that causes a body function to deviate from its stable range, processes are initiated to restore and maintain the steady state or homeostasis. B. Constancy. Constancy refers to the balanced internal state of the human body maintained by physiologic and biochemical processes. C. Adaptation. Adaptation refers to a constant, ongoing process that requires change in structure, function, or behavior so that the person is better suited to the environment. D. Stress. Stress refers to a state produced by a change in the environment that is perceived as challenging, threatening, or damaging to the person's dynamic balance or equilibrium. Answer: A. Question 26. Which of the following terms, according to Lazarus, refers to the process through which an event is evaluated with respect to what is at stake and what might and can be done? A. Cognitive appraisal. The outcome of cognitive appraisal is identification of the situation as either stressful or non-stressful. B. Coping. Coping consists of both cognitive and behavioral efforts made to manage the specific external or internal demand that taxes a person's resources. C. Hardiness. Hardiness is a personality characteristic that is composed of control, commitment, and challenge. D. Adaptation. Lazarus believed that adaptation was affected by emotion that subsumed stress and coping. Answer: A. Question 27. An increase in the number of new cells in an organ or tissue that is reversible when the stimulus for production of new cells is removed is termed A. Hyperplasia. Hyperplasia occurs as cells multiply and are subjected to increased stimulation resulting in tissue mass enlargement. B. Hypertrophy. Hypertrophy is an increase in size and bulk of tissue that does not result from an increased number of cells. C. Atrophy. Atrophy refers to reduction in size of a structure after having come to full maturity. D. Neoplasia. With neoplasia, the increase in the number of new cells in an organ or tissue continues after the stimulus is removed. Answer: A. Question 28. Which of the following types of cells have a latent ability to regenerate? A. Stable. Stable cells have a latent ability to regenerate if they are damaged or destroyed and are found in the kidney, liver, and pancreas, among other body organs. B. Labile. Labile cells multiply constantly to replace cells worn out by normal physiologic processes. C. Permanent. Permanent cells include neurons, the nerve cell bodies, not their axons. Destruction of a neuron causes permanent loss, but axons may regenerate. D. Epithelial. Epithelial cells are a type of labile cell that multiply constantly to replace cells worn out by normal physiologic processes. Answer: A. Question 29. The relaxation techniques of progressive muscle relaxation, relaxation with guided imagery, and the Benson Relaxation Response share which of the following elements? A. A mental device, something on which to focus the attention. Similar elements also include a quiet environment, a comfortable position, and a passive attitude. B. Nutritional foundation. Relaxation techniques do not encompass specific nutritional guidelines. C. Analgesic preparation. Relaxation techniques are used to reduce one's response to stress and do not require analgesia prior to practicing the techniques. D. Physician's order. A physician's order is not required to assist an individual to learn techniques to reduce one's response to stress. Answer: A. Question 30. Which of the following terms has been defined by the American Psychiatric Association as a group of behavioral or psychological symptoms or a pattern that manifests itself in significant distress, impaired functioning, or accentuated risk of enduring severe suffering or possible death? A. Mental disorder. The definition was adopted by the American Psychiatric Association in 1994. B. Emotional disorder. There is no universally accepted definition of what constitutes an emotional disorder. C. Anxiety. Anxiety is defined as fear of the unknown. D. Schizophrenia. Schizophrenia is a specific disorder characterized by psychosis. Answer: A. Question 31. Establishing financial security has been identified as a developmental task of which of the following groups? A. Middle adult. The middle adult's tasks also include launching children, and refocusing on one's marital relationship. B. Older adult. The older adult's tasks include adapting to retirement and declining physical stamina. C. Young adult. The young adult's tasks include establishing a lifestyle and independence. D. Teenager. The teenager's primary developmental tasks include developing an identity and intimacy. Answer: A. Question 32. When up to a 6-month period elapses between the experience of trauma and the onset of symptoms of post-traumatic stress disorder (PTSD), the episode is termed A. Delayed. In the case of delayed PTSD, there may be up to a 6-month period of time that elapses between the trauma and the manifestation of symptoms. B. Acute. Acute PTSD is defined as the experience of symptoms for less than a 3-month period. C. Chronic. Chronic PTSD is defined as the experience of symptoms lasting longer than 3 months. D. Primary. The concept of primary disease is not used in relation to PTSD. Answer: A. Question 33. Which of the following statements accurately describes a risk factor for depression? A. History of physical or sexual abuse. History of physical or sexual abuse and current substance abuse are risk factors for depression. B. Male gender. A risk factor for depression is female gender. C. Age over 50 years. A risk factor for depression is onset before 40 years. D. Negative family history of depression. Family history of depression is a risk factor. Answer: A. Question 34. Of the following stages of grieving as described by Kubler-Ross, which is the initial? A. Denial. The stages include denial, anger, bargaining, depression, and acceptance. B. Anger. Anger is the second stage of the process. C. Bargaining. Bargaining is the third stage of the process. D. Depression. Depression is the fourth stage of the process. Answer: A. Question 35. Which of the following terms refers to Leininger's description of the learned and transmitted knowledge about values, beliefs, rules of behavior, and lifestyle practices that guide a designated group in their thinking and actions in patterned ways? A. Culture. Leininger was the founder of the specialty called transcultural nursing and advocated culturally competent nursing care. B. Minority. Minority refers to a group of people whose physical or cultural characteristics differ from the majority of people in a society. C. Race. Race refers to a group of people distinguished by genetically transmitted characteristics. D. Subculture. Subculture refers to a group that functions within a culture. Answer: A. Question 36. The inability of a person to recognize his or her own values, beliefs, and practices and those of others because of strong ethnocentric tendencies is termed A. Cultural blindness. Cultural blindness results in bias and stereotyping. B. Acculturation. Acculturation is the process by which members of a culture adapt or learn how to take on the behaviors of another group. C. Cultural imposition. Cultural imposition is the tendency to impose one's cultural beliefs, values, and patterns of behavior on a person from a different culture. D. Cultural taboo. Cultural taboos are those activities governed by rules of behavior that are avoided, forbidden, or prohibited by a particular cultural group. Answer: A. Question 37. Which of the following groups of individuals may stare at the floor during conversations as a sign of respect? A. Native Americans. Some Native Americans stare at the floor during conversations, conveying respect and indicating that the listener is paying close attention to the speaker. B. Indo-Chinese. The Indo-Chinese may consider direct eye contact impolite or aggressive. C. Arabs. Arabs may consider direct eye contact impolite or aggressive. D. Asians. Asians may consider direct eye contact impolite or aggressive. Answer: A. Question 38. For which of the following religious groups is all meat prohibited? A. Hinduism. Hinduism prohibits consumption of all meats and animal shortening. B. Seventh-day Adventism. Seventh-day Adventism prohibits consumption of pork. C. Judaism. Judaism prohibits consumption of pork. D. Islam. Islam prohibits the consumption of pork and animal shortening. Answer: A. Question 39. The paradigm that explains the cause of illness as an imbalance in the forces of nature is the A. Holistic perspective. The naturalist or holistic perspective believes that health exists when all aspects of a persona are in perfect balance or harmony. B. Magico-religious view. The magico-religious view holds that illness is caused by forces of evil. C. Biomedical view. The biomedical view holds life events as cause and effect and incorporates the bacterial or viral explanation of communicable disease. D. Scientific view. The scientific view holds life events as cause and effect and incorporates the bacterial or viral explanation of communicable disease. Answer: A. Question 40. The aim of genomic medicine is A. Improving predictions about individuals' susceptibility to diseases. Predictions regarding the time of their onset, their extent and eventual severity, as well as which treatments or medications are likely to be most effective or harmful, are the focus of genomic medicine. B. Reproduction. The focus of genomic medicine is broader than the reproduction of cells. C. Cure of disease. The focus of genomic medicine is broader than the cure of disease. D. Cloning. Genomic medicine is gene-based healthcare. Answer: A. Question 41. Non-disjunction of a chromosome results in which of the following diagnoses? A. Down syndrome. When a pair of chromosomes fails to separate completely and creates a spermatocyte that contains two copies of a particular chromosome. Non-disjunction Down syndrome results from 3 number 21 chromosomes. B. Huntington disease. Huntington disease is one example of a germline mutation. C. Duchenne muscular dystrophy. Duchenne muscular dystrophy, an inherited form of muscular dystrophy, is an example of a genetic caused by structural gene mutations. D. Marfan syndrome. Marfan syndrome is a genetic condition that may occur in a single family member as a result of spontaneous mutation. Answer: A. Question 42. Which type of Mendelian inherited condition results in both genders being affected equally in a vertical pattern? A. Autosomal dominant inheritance. An individual who has an autosomal dominant inherited condition carries a gene mutation for that condition on one chromosome of a pair. B. Autosomal recessive inheritance. The pattern of inheritance in autosomal recessive inherited conditions is different from that of autosomal dominant inherited conditions in that it is more horizontal than vertical, with relatives of a single generation tending to have the condition. C. X-linked inheritance. X-linked conditions may be inherited in families in recessive or dominant patterns. In both, the gene mutation is located on the X chromosome. All males inherit an X chromosome from their mother with no counterpart, hence, all males express the gene mutation. D. Multifactorial genetic inheritance. Neural tube defects, such as spina bifida and anencephaly, are examples of multifactorial genetic conditions. The majority of neural tube defects are caused by both genetic and environmental influences that combine during early embryonic development, leading to incomplete closure of the neural tube. Answer: A. Question 43. A specific BRCA1 cancer-predisposing gene mutation seems to occur more frequently among women of which descent? A. Ashkenazi Jewish. Expression of the BRCA1 gene is an example of inheritance in the development of breast cancer. B. Mediterranean. Glucose-6-phosphate dehydrogenase deficiency (G6PD) is a common enzyme abnormality that affects millions of people throughout the world, especially those of Mediterranean, Southeast Asian, African, Middle Eastern, and Near Eastern origin. C. African American. Sickle cell anemia is associated with the African American population. D. Chinese and Japanese. Individuals of Chinese and Japanese descent who are rapid metabolizers of the enzyme N-acetyltransferase and who are prescribed the drug isoniazid as part of treatment for tuberculosis are at significantly increased risk for developing isoniazid-induced hepatitis. Answer: A. Question 44. Which of the following statements describes accurate information related to chronic illness? A. Most people with chronic conditions do not consider themselves sick or ill. Although some people take on a sick role identity, most people with chronic conditions do not consider themselves sick or ill and try to live as normal a life as is possible. B. Most people with chronic conditions take on a sick role identity. Research has demonstrated that some people with chronic conditions may take on a sick role identity, but they are not the majority. C. Chronic conditions do not result from injury. Chronic conditions may be due to illness, genetic factors, or injury. D. Most chronic conditions are easily controlled. Many chronic conditions require therapeutic regimens to keep them under control. Answer: A. Question 45. In which phase of the trajectory model of chronic illness are the symptoms under control and managed? A. Stable. The stable phase indicates that the symptoms and disability are under control or managed. B. Acute. The acute phase is characterized by sudden onset of severe or unrelieved symptoms or complications that may necessitate hospitalization for their management. C. Comeback. The comeback phase is the period in the trajectory marked by recovery after an acute period. D. Downward. The downward phase occurs when symptoms worsen or the disability progresses despite attempts to control the course through proper management. Answer: A. Question 46. Which phase of the trajectory model of chronic illness is characterized by reactivation of the illness? A. Unstable. The unstable phase is characterized by development of complications or reactivation of the illness. B. Stable. The stable phase indicates that the symptoms and disability are under control or managed. C. Acute. The acute phase is characterized by sudden onset of severe or unrelieved symptoms or complications that may necessitate hospitalization for their management. D. Comeback. The comeback phase is the period in the trajectory marked by recovery after an acute period. Answer: A. Question 47. Which phase of the trajectory model of chronic illness is characterized by the gradual or rapid decline in the trajectory despite efforts to halt the disorder? A. Dying. The dying phase is characterized by stoppage of life-maintaining functions. B. Unstable. The unstable phase is characterized by development of complications or reactivation of the illness. C. Acute. The acute phase is characterized by sudden onset of severe or unrelieved symptoms or complications that may necessitate hospitalization for their management. D. Downward. The downward phase occurs when symptoms worsen or the disability progresses despite attempts to control the course through proper management. Answer: A. Question 48. In order to help prevent the development of an external rotation deformity of the hip in a patient who must remain in bed for any period of time, the most appropriate nursing action would be to use A. A trochanter roll extending from the crest of the ilium to the mid-thigh. A trochanter roll, properly placed, provides resistance to the external rotation of the hip. B. Pillows under the lower legs. Pillows under the legs will not prevent the hips from rotating externally. C. A hip abductor pillow. A hip abductor pillow is used for the patient after total replacement surgery. D. A footboard. A footboard will not prevent the hips from rotating externally. Answer A. Question 49. To prevent foot drop, the patient is positioned in A. Order to keep the feet at right angles to the leg. When the patient is supine in bed, padded splints or protective boots are used. B. A semi-sitting position in bed. Semi-Fowler's positioning is used to decrease the pressure of abdominal contents on the diaphragm. C. A sitting position with legs hanging off the side of the bed. In order to prevent foot drop, the feet must be supported. D. A side-lying position. Side-lying positions do not provide support to prevent foot drop. Answer A. Question 50. Through which of the following activities does the patient learn to consciously contract excretory sphincters and control voiding cues? A. Biofeedback. Cognitively intact patients who have stress or urge incontinence may gain bladder control through biofeedback. B. Kegel exercises. Kegel exercises are pelvic floor exercises that strengthen the pubic-coccygeus muscle. C. Habit training. Habit training is used to try to keep the patient dry by strictly adhering to a toileting schedule and may be successful with stress, urge, or functional incontinence. D. Bladder training. Habit training is a type of bladder training. Answer A.
Thanks for watching. Please comment, like and share.